So IBD stands for inflammatory bowel disease. And it's a family of diseases, with the two major ones being Crohn's disease and ulcerative colitis. And these two conditions are characterized by inflammation that occurs in the gut, and we really don't know why it occurs. There are many hypotheses. But ulcerative colitis is a disease of the colon. So your large intestine, your colon, the lining becomes inflamed for unexplained reasons. On the other hand, in Crohn's disease can affect any part of the GI tract, but it has a predilection for the end of the small intestine in some patients, the colon in other patients, and then in some patients, all of it. And it can even affect the stomach, the esophagus. And both of these conditions have manifestations outside of the intestine in the form of various types of arthritis and skin rashes and some ocular issues. They're diseases that affect predominantly young people. So certainly, I think the median age that we see at Sonar is like 41, 42. But, children can present with it. But most people will present in their 20s and 30s with symptoms. But there are even some folks who develop this in elderly years as a first-time occurrence. But basically, the gist of the diseases they are unexplained, uncontrolled inflammation of various parts of the intestine, and it's a chronic, lifelong disease. Once you get this, it is not going to go away. It's going to be part of you for the rest of your life. Early in my career, we felt that IBD was a disease predominantly of industrialized societies, city folks more than rural, and people of Jewish background. Today, it's much less that. It affects all forms, all genders, both genders, and all races and ethnic categories. We do see some minor variations in the ethnicities, but everybody can develop these diseases. It's interesting that in China, it wasn't very well known in the 50s and the 60s, but as China has become more industrialized, we're seeing it more and more over there as well. It does seem to have a predilection for more urban than rural environments. There's been an explosion in drug treatments available for IBD. Prior to the early 2000s, we had very limited therapies. Prednisone, some oral medications that really were minimally effective. But back in the 2000s, we had our first availability to start treating patients with what are called biologic medications. And so the two main drugs were Remicade and Humira, and they began this revolution in the treatment of these diseases. But over the last 5 to 10 years, there has been a further explosion in drugs treating multiple different aspects of the immune system. And now we're actually seeing combos where we're actually testing patients on more than one drug at a time, so that you can target different aspects of the immune system concurrently. And this is useful because as expensive and as effective as drugs are, we can't cure the disease, number one, and we really only control it in about half the population that receives the drugs. So the ability to start combining these medicines will hopefully enable us to treat even a higher percentage of the population.